In your Health Watch tonight, addiction recovery organizations are urging Governor Kate Brown to take quick action to address what they're calling a workforce crisis in the behavioral health care system. Fox 12's Sarah Hurwitz spoke with a statewide advocacy organization about why there's a shortage.
The Oregon Recovers executive director says this is pushing the system to the brink of collapse, with drug counselors, social workers, and peer mentors all quitting.
The organization Oregon Recovers aimed to get their message across by displaying more than 1,200 flags on the lawn from across the state capitol. They represent Oregonians who've died this year because of substance abuse.
According to a new bill, House Bill 3296, Oregon has the third highest untreated addiction rate in the nation, ranking 47th in access to addiction treatment. The Addiction Crisis Recovery Act aims to increase taxes on alcohol to fund behavioral health and substance use programs.
Oregon Recovers, the addiction recovery advocacy group, has helped launch the Oregon Recovery Network website, putting a plethora of resources on one page. But through it all, someone struggling with substance abuse can still get personal attention.
Hello, walkers. I'm Seata Medmo, and whatever part of the state you're in, I'd like to welcome you. We've got a fun program in store for you today with folks representing all parts of the state and every corner of the recovery community. We'll start out with Terry, my Oregon Recovers Steering Committee co-chair, talking about why this year's walk is so important to our community. Next, no program from us would be complete without co-founder and executive director Mike Marshall updating you on the work of Oregon Recovers over the last year. We also want to give a huge shout out and a thank you to this year's sponsors. Mike will give you the rundown of the many organizations who have helped make today possible. We'll talk with folks in recovery. We'll hear from Tanya, who lost her son to addiction and who immediately turned her grief into activism. One of our sponsors in Medford will talk about how in their Southern Oregon community, which is a national hotspot for COVID, is also managing to address the needs of addiction, which kills more Oregonians than COVID has. We all know the infamous Tony Vezina from 4D Recovery Center here in Portland, who will join us, but you never know quite what to expect from Tony, so stay tuned for that. We'll wrap up today's presentation on the walk with COVID protocols and ways to get more involved with Oregon Recovers through next month's Recovery Community Summit. After that, get out there, show your pride in recovery by donning your shirt and walking for recovery. Thank you for being here. Now let's go to Terry in Eugene.
Hi everyone, my name is Terry Morgan Uri. I'm a person in long-term recovery from substance abuse. I've overcome addiction, homelessness, domestic violence, having my children in DHS custody, and criminality. Today I'm the program coordinator at Springfield Treatment Center, and I'm also proud to serve as the co-chair for Oregon Recovers on the steering committee. As someone who is deeply committed to helping others find their way to a better life in recovery, I'm here today to talk about why the 2021 Walk for Recovery is so important this year. Most people find it shocking to learn that drug and alcohol-related deaths kill more Oregonians than even COVID. It's true. We are here today to celebrate recovery, which COVID made such a challenge for so many. Our meetings were ripped away from us, our families became more difficult to spend time with, our jobs became virtual, we've been isolated and disconnected. These have been lonely and hard times, and I get that. I think we all do. Today's walk is a first opportunity to really come together and celebrate recovery. Now more than ever, we need to celebrate. COVID has lasted longer than anyone could have anticipated. That's why today's walk is so important. This is about community. This is about connection. Now, we've changed the walk this year to respond to the pandemic, but the opportunity to come together and celebrate recovery is so important now more than ever. I am proud of my years in recovery, and I know you are too. You're signed up, you've got your shirt. Now grab a friend, family member, a neighbor, and get out there and walk and show our communities that we do recover. Have fun.
I'm walking for recovery because it takes people like me and you to save people like me and you.
What does recovery look like to you as a Native American woman? So what was told to me in the beginning was that everybody's recovery looks a little different. What works for me might not work for you, you know? And so I just really, well, let me back up a little bit. In my first time in recovery, I didn't understand that. So I thought I just had to be one way. If I was doing NA, I just had to be that one way. If I was doing AA, it had to be that one way. You know, I didn't know I could find my own way, you know, and so a lot of things I didn't understand or comprehend. And then this second time around, I really did my best to take my time, figure out what worked for me. And so I work at NA program, and I go to Wellbriety for my culture and to be a part of my culture and to hear the drumming and the singing and being around other Native Americans. And that's what really helps me in my spirit, you know, and I do what works for me. So I think just letting that person have that opportunity to decide for themselves what they want their recovery to look like is amazing. That's letting them decide, you know, like, hey, this works for me or this doesn't work for me.
So what I hear you saying is like there's many different pathways to recovery.
Yep.
And yet also like supporting somebody and helping them walk through what that looks like, and you know what I mean, like obtaining goals and you know, just things like that, right? Those beautiful gifts we get in early recovery. Like, you know, it almost kind of like, it would be amazing if we had like things like that, like peer services.
Oh, we do. We do.
We do, huh? So are you walking in the Walk for Recovery?
Yes, I'll be walking with my Painted Horse Recovery where I work. I'm a mentor.
Okay.
We have mentor services specifically for the Native American Indigenous people. So walking for recovery to me means, you know, let's get aware, we're here, this is happening, everybody, you know, deserves recovery.
Okay.
Everybody deserves recovery.
And so the Walk for Recovery, you know, do you think it's good for not only our community, but for everybody to get out and walk for recovery, like whatever that looks like?
You know, our addiction does not discriminate, you know, and so when we're gonna try to heal and come together as a community, we all need to, you know, participate and support one another, because that's how I stayed clean. If I didn't have that support or the community or somebody walking with me, not walking my path for me, like they teach us, walking it with me and helping me and encouraging me, I probably wouldn't be clean today.
So would you encourage others to walk in the Walk for Recovery?
Yeah, definitely.
Thank you. Thank you for the interview.
You're welcome.
My name is Tanya Karlowitz. I am forever Blake's mama. Blake is my firstborn son, arriving in my life to shake me into becoming the person I was meant to be, changing my life in a way that may have saved my life. Blake slipped away to the other side after a fentanyl overdose on July 15, 2019. He was 28 years young. I participate in the Walk for Recovery to honor Blake and the fight that he waged on substance use disorder for nearly 10 years. I participate to continue his fight by being present and raising my voice and his. To say that the monster of addiction only gains strength in this silence, in the shadows. Labels like junkie, tweaker, meth head, fiend only serve to dehumanize and shame a person struggling with substance use disorder and their loved ones. The attitudes of society toward people afflicted by substance use disorder keep people in isolation, exactly the opposite of what is needed for recovery. In isolation, the monster's whispers become roars that the afflicted cannot ignore. That's the disease. Today I walk with and connect with the recovery community within the Central Oregon community. I walk to celebrate recovery, and I walk toward hope that the stigma of substance use disorder dissolves, so that people affected can get the help they need to realize their incredible potential and share their unique talents and perspectives within their communities. We are all connected. Blake wanted so much more. Blake was so much more. So I walk. My name is Tanya Karlowitz. I am forever Blake's mama.
I'm walking for recovery to bring awareness. Hey Walkers, I'm Mike Marshall. I have the honor and privilege of serving as Executive Director of Oregon Recovers, and I want to thank each and every one of you for participating in today's Walk for Recovery, wherever you are in the state. We launched the Walks for Recovery 4 years ago to bring home 3 things about Oregon Recovers. Is number 1, we build community, and today is all about community. Now, you want to stay 6 feet apart, but the fact is that we want to be out on the streets, we want to be in our nifty t-shirts, and we want people to see that we're out and in recovery. We develop policy and we advance policy to end Oregon's addiction crisis, and that's hugely important. And lastly, we advocate for those policy changes, and we help educate policymakers to do the right thing, to stand up to the alcohol industry, to stand up to Big Pharma, and to stand up to inertia and actually solve Oregon's addiction crisis. Today is about celebrating those three things, and it's about promoting those 3 things. So we're so very grateful that you're here. In the last year, we've launched the Oregon Recovery Network, which is designed to be a resource for you and your friends looking for different resources in recovery. It's OregonRecoveryNetwork.org. Check it out. You can get connected to a peer there. We also launched the Addiction Recovery Assistance Fund, where we're working with recovery housing advocates, with MACBO, with Seating Justice Foundation to help people stay in their recovery housing and to help the recovering housing organizations survive the COVID pandemic. We are so grateful for all of you and the fundraising you did today. I'm happy to announce, as of when we're taping this, we've raised over $75,000. Our goal is $100,000. So we're really hopeful that, number 1, not only you're walking today, but while you're doing so, you're texting a link to your fundraising page to your friends and family who saw you back when you were out there drinking and using, and they can totally appreciate that you're actually being of service in community today. Mostly, we just want you to go out and have a really good time. Celebrate your recovery, make lots of noise, but stay 6 feet apart, and just know that by walking today, by being in community today, by recruiting people to be with you today, we're actually saving lives, because at the end of the day, the money we raise and the power that we convey is going to help us end Oregon's addiction crisis. So thank you again for being here today. We're really grateful for your participation. Please stay safe.
Hey everybody, my name is Christy Lashober, and I am the Community Resource Director for Recovery Cafe Reclaiming Lives. And we are super excited to be a part of this event for Walk for Recovery, where we can promote recovery, show the community that we do recover, we do have so much joy and love each other on a regular basis. I think the reasons why Southern Oregon wants to be a part of this, I know for us, it's because we are big believers at squashing stigma. Stigma damages self-esteem, stigma keeps people separate and keeps people alone, and a lot of it is based from judgment and from not having really the knowledge. So we are going to be out there showing people exactly what recovery looks like. At Recovery Cafe, we also have a podcast called Survivors of Addiction, where Brandon Orr and I share our own experiences of stigma, which will be on the next episode that will be out in a few weeks. And we talk about how stigma hurt us as children prior to even being in addiction, and how that, like I said, keeps people separate. So this Walk for Recovery is doing the opposite of that. We are in a big group showing people that we are one and we are supported and supportive of our community. Actually, one of the biggest reasons that I like sharing this is because of my own personal story. I went to federal prison because I was so deep into shame and I didn't ask for help. So I have 8 years now, and shame is squashed. I talk out loud about it all the time so people know that I'm not ashamed, and I want to be there for the other suffering addicts. So you guys, super excited to be here, and I'll see you at the finish line.
I am walking for Trevor and Lainey, who need their path to recovery.
All right, take 55. Hey everybody, what's up? Tony V here from 4D Recovery, here to talk to you about Oregon Recovers and the Walk for Recovery. I've been with Oregon Recovers for a long time. I really support its purpose. It's really needed. It does a lot of advocacy on behalf of people with substance use disorder. I'm here to tell you today that you should participate in the Walk for Recovery and help donate to raise money for Oregon Recovers so that everyone in Oregon gets an opportunity like me, to celebrate recovery. I was able to celebrate 9 years of recovery this last year despite the pandemic. Not everybody was as fortunate as me, and we need your help to ensure that next year and the years following that people do not get excluded from the gift of recovery.
Why should folks support Oregon Recovers financially?
People should support Oregon Recovers financially because Oregon Recovers supports them. Oregon Recovers is in the trenches every day, pushing policy, pushing our legislators, pushing the governor to do something about the addiction crisis in Oregon. And it is a crisis. Oregon Recovers currently has the highest rates of substance use and the lowest rates of access to recovery and treatment services compared to the other 50 states, and that's just unacceptable. And Oregon Recovers won't stop until every single person in Oregon has the opportunity to get the services they need to survive and thrive.
So what will my $25 registration fee really do?
$25 may not seem like a lot of money, but in the collective, in the aggregate, when all the people across Oregon come together and they donate $25 and they do the Walk for Recovery, it shows that Oregonians really care about this issue. And collectively, all of the private fundraising we're going to do over the next year is really going to ensure that Oregon Recovers has the resources and the means it needs to keep pushing the system forward.
So the walk is today. Is the fundraising done, or should folks keep fundraising?
People should fundraise today. They should fundraise tomorrow. We should have got money last week, 80 years ago. This issue has been going on for too long, and we really need your support. So if you can help us fundraise some additional money from your friends or family, that would really be great. If you can't fundraise, I understand. If you can show up to a rally, sign up for our newsletter, find other ways to participate. We just want everybody involved in the solutions that we're creating.
Tony, thank you.
Hey, thank you, and I hope to see all you guys soon.
All right. Thanks, Tony. Tough act to follow there. I'm Jesse Cornett. I'm the Interim Policy and Advocacy Director here at Oregon Recovers. It's a role I'm very proud to be in. Thanks so much for being here today, and thank you so much for getting out there and walking. Just a little about my role. It's my role to make sure policymakers around the state know about what issues that impact the recovery community and pushing them to make changes when necessary. I literally could not do my job without your support. So again, thank you. I'm going to talk about logistics here in just a second. Later in the program, my colleague Sam Nishi will talk about how to be as safe as possible in light of COVID. The one word I would apply to today's walk is simplicity. All you got to do is head to City Hall if you're in Portland, Medford, or Klamath Falls, Wayne Morse Free Speech Plaza in Eugene, and Troy Field and Bend. There, you can get your t-shirt, your Hazel and Betty Ford backpack, your route map, and a nifty Oregon Recovers face mask, and get out there and walk the route. That's it. While you're there, make sure you grab a Recovery Is sign, fill out what recovery means to you, and tape it to our recovery wall to let the world know how important this is. When you're out there walking, most importantly, have fun. Keep a distance from folks if you see other walkers out there, if you see other folks in the community as well, but maybe get just close enough where they can see your nifty t-shirt. With that, I'm going to hand it back over to Tony and Mike. Thanks, everyone.
Okay, dude. How's my hair?
It's there for sure. How's this looking? Can they make it bigger?
Your implants are looking good, buddy.
Well, can they make them bigger? Oh, I think we're on.
Tony and Mike back here to talk to you about our amazing sponsors this year. We have more than we've ever had before. Big shout out to Hazelton Betty Ford Foundation.
Also, Hazelton Betty Ford Graduate School of Addiction Studies.
Trillium Community Health Plan.
We also got Cedar Hills Hospital.
Alcamiras.
Central City Concern and all the great work that they're doing and all their programs and staff who enrolled for the walk, all of that, just really big supporters of Oregon Recovers.
NADAC of Oregon, which is all the CADCs and peer mentors and things like that. Thank you.
long-time supporter, Kaiser Permanente. Shout out to Brad and Paul.
And a new sponsor this year, Boulder Care. Thank you.
Trillium Family Services as well.
And then Terry, who you heard from before at Oregon Recovery and Treatment Centers, ORTC, thank you very much.
We got a new sponsor with Volunteers of America, VOA. I went there. Shout out to everybody at VOA.
And then the thing called 4D Recovery.
4D.
4D!
Star Body Works.
Cascadia Behavioral Health Care.
Rainier Springs Hospital.
Also a new sponsor this year. Our friends at Gobi, the Greater Oregon Behavioral Health, Inc.
Yeah, thanks, Karen. Jackson Care Connect, Confederate Tribes of the Grand Ronde.
Adam Caballo and his practice down in Medford.
City of Portland.
Our buddy Izzy at Go the Distance. Go Izzy, man. That's
Izzy,
great.
Yeah. Clackamas County. Thanks, everybody at Clackamas County.
And same with Washington County. Thank you guys very, very much.
Bend Broadband. Thank you so much.
Another new sponsor this year. And then the last, but certainly not least,
Miracles Club.
All right.
Thanks, Julie, and everybody over at Miracles.
Thanks to all our sponsors. We couldn't do the work that we're doing that you've heard about without all their support, especially during COVID. So they do amazing work, all of those providers, and we're really, really grateful for their support.
Yeah, thanks, everyone.
Thanks, Mike and Tony. We need your help to keep the Walk for Recovery as low risk as possible. You can help by wearing a face covering whenever you're interacting with anyone outside your team, especially our awesome volunteers, by keeping at least a 6-foot distance from volunteers and other teams whenever possible. And lastly, if you're feeling sick in any way or were in contact with anyone who's tested positive for COVID-19 in the past week, please stay home today. Our community is stronger together, but only if we're all invested in keeping each other safe and healthy. Have an awesome Walk for Recovery. Now back to you, Mike.
Hey everybody, me again with one last thing. Don't forget to register for the 3rd Annual Recovery Community Summit, October 23rd and 24th. In person at the Red Lion Hotel in Portland. Visit www.recoverysummit.org. It's designed to be a low-risk event, which means that you will have to show proof of vaccination upon arrival. We're going to give you a free rapid COVID test, and everyone will be required to wear a mask. I realize that's controversial, but it's the best way we can guarantee everyone stays safe. We've got over 16 workshops and panels already planned for the 2 days or the day and a half, as well as CEUs available through MACBO. Go to www.recoverysummit.org. Early bird registration until September 30th is $119. After that, it's $169. There's a reduced rate on the for hotel rooms. Just go to the website. And there's also limited scholarships available, which you can apply for on the website, which again is www.recoverysummit.org. We hope to see you at the Recovery Summit next month, and please stay safe today.